Chiropractic improve your mental health? Well, according to an article by Psychology Today that was just published, it can. According to chiropractors who've been doing it a long time, it does, if you ask me. So an article was recently published in the Psychology Today talking about chiropractic improving studies of showing. So the enteric nervous system, your gut and central nervous system, brain and spinal cord, uniquely and indistinctly tied together. Transmitter release is always coordinated from the stomach to the brain and vice versa. It goes back and forth, brain to stomach. So in this, there's some key points. They talk about spinal manipulation, modulates vagal tone, potentially improving stress resilience and emotional regulation. And they're saying research shows chiropractic adjustments reduce inflammation that affects both gut health and brain function, and improve nervous system function following chiropractic positively influences the gut microbiome. So that's a really interesting take, because a lot of people think you need to just constantly dump probiotics into your gut to enhance your microbiome. And now they're seeing that just enhancing the brain's connection to the gut via chiropractic manipulation is also improving the microbiome. I'm just kind of going to go through it quick. I have the article here with me. So the bidirectional communication between our central nervous system and enteric nervous system, like I just discussed, serves as a critical conduit in the network, transmitting signals between the brain, the rest of the body, and the gut. Pretty straightforward there. I don't have to elaborate too much further on that. Now they're going into research on chiropractic care and mental health pathways and the autonomic nervous system regulation. So multiple clinical studies demonstrate that spinal manipulation influences autonomic nervous system function. Study they mentioned by Kingston and others in 2014 found significant evidence that spinal adjustments alter heart rate variability, a key marker of autonomic function and stress resilience. Since autonomic dysregulation features prominently in anxiety disorders, depression, and trauma responses, these findings suggest a mechanism through which chiropractic care may support well-being. So just to go on and elaborate a little bit more, people who get adjusted aren't as stressed out. Doesn't mean they don't get as stressed out. That's why they get adjusted, right? So a good portion of my patients aren't in because their back hurts. They're in so they can focus, so they can concentrate and get rid of the tension. A lot of times that tension manifests in the upper cervical spine, the top of the neck. It's a routine thing for patients to walk in and say, I think I'm holding my stress here. I've talked about it in videos in the past. I've talked about it with, in different lectures and stuff. But basically, of course, you hold your stress close to your brain. That's where it is. So it's called the central nervous system for a reason. And when there's interference in your central nervous system, you're going to feel probably nervous, right? So it makes sense that if you clear that interference in the nervous system, there can be harmony between the brain's communication to the rest of the body. And that's a big concept to grasp. We're doing a lot. I'm seeing a lot. There's a lot of products. There's a lot of talks. There's a lot of breathing techniques, all very good as stress reduction and trying to feel less tense. But if you get adjusted, it's very quick, very powerful, and you're removing those things that you're trying to breathe through or trying to supplement your way through. In some instances, people may take a bunch of like maybe magnesium, trying to calm their nervous system, or using valerian root, or a whole bunch of different things that people are using for natural relaxation. But if there's interference in the central nervous system, you're not even really properly processing those. As you see in these studies here, if you dig through this article, the gut is largely controlled through the brain, and vice versa. They go back and forth. So if you have communication between your neck, so we'll use your neck, for example, to your gut, if you're putting in a bunch of products, you might not even assimilate those because the gut isn't firing the way it should be. Process in the gut, which is an imbalance in the gut, an imbalance in the biome, starts dictating what your brain is actually thinking and feeling. So bad gut health will actually cause bad brain chemistry, and vice versa. It goes back and forth. And certainly that's something that needs to be rebuilt. But if we could adjust a patient who has dysbiosis in the gut, they can get some peace right away and they can start focusing. And then maybe you're putting in probiotics, you're doing large intestine acidifiers, you're trying to regulate the pH of the digestive system. Well, now the nervous system is actually free to process that because the enteric nervous system, your gut, isn't processing what the brain's chemistry has to look like. You free that up a bit. And the way we free that up is by regulating the vagus nerve's function, which is your parasympathetic, right? And a lot of this article does go into talking about the vagus nerve is where they're doing it, right? And everyone parasympathetic, what is that? That's rest and digest. So your sympathetic nervous system is your fight or flight, ready to go. Someone scares the hell out of you, you tense up, or you get nervous, so you get your muscles get fired up. We have to have the sympathetic nervous system, obviously, for a variety of reasons. But if we get sympathetic dominant, meaning we're stuck in a sympathetic state, then a whole list of dis-ease starts to ensue. So I say dis-ease, two different words, the loss of ease, not disease, like you have this disease and you're stuck with it forever, which is a very common allopathic way to call things, and then you identify as your disease, and not someone who's unwell, right? The goal is to restore wellness. And when you're at ease, you're healthy, right? So that's just a side note on nomenclature. So when you restore the brain's connection to the body via freeing up the parasympathetic nervous system, which is what exits down the base of the skull, down the back of your neck, and it controls your heart rate, it controls your digestion, that rest and digest, right? What is that? After you eat a meal, you get tired, you can't fall asleep, right? So I know no one watching this video has ever had a sleepless night or indigestion or the inability to, slow their breathing, because that never happens. But when you're in that state, that's parasympathetic insufficiency, and you're sympathetic dominant. There are nutrients that do that. But we've seen time and time again that with chiropractic manipulation of the spine, we can really activate that parasympathetic nervous system, get someone to rest. Another thing that does that is acupuncture. Acupuncture puts patients a little bit more into the parasympathetic state. Chiropractic normalizes the nerve tone, and then your body will regulate into the parasympathetic state or sympathetic state if that's where you need to be. But you have to clear out that interference in the central nervous system. And then the microbiome influence, basically saying that the nervous system is actually indicative of microbiome health, which is phenomenal news, right? Because that means it's not everything that's going in, right? So if you have a functioning nervous system and maybe you do eat something that's off one night, you'll be resilient enough because the nervous system ultimately is controlling everything. Hypothalamic pituitary axis modulation is in the brainstem. The article goes to point out that chiropractic adjustments appear to influence hypothalamic pituitary adrenal axis function, potentially normalizing cortisol patterns often disrupted in depression and anxiety disorder. So what is that saying? Well, the hypothalamic pituitary axis is in your brainstem. It's very active when you sleep at night, when you're parasympathetic, and it's also largely responsible for your hormones. It's one of the highest orders of hormone regulation in the body. And cortisol, as we know, is the stress hormone, lowers immune response when it's constantly elevated, weight gain, fatigue, achiness, that kind of chronic fatigue picture. High cortisol, that's kind of what we're thinking. Chiropractic has been shown to regulate that control system. So chiropractic has been displayed as a thing you go for back pain. And it's super effective with back pain. That's certainly, I would say the gold standard at treating the spine, because that's what you're treating. You can treat the spine a lot of other ways that don't involve treating the spine, but I wouldn't recommend it. So if the spine is the issue, you treat it for back pain. But the bigger picture is that chiropractic is an overall form of healthcare. And when they're talking about getting rid of things like anxiety, depression, or at least affecting those in a positive way, you're lowering your need for medication, you're returning back to a proper lifestyle, and you're able to get on with what really matters in your life. I mean, you have everything in the world until you're sick, and then you only have that one thing. So anyone who's struggled with any kind of health flare-up knows when it's real bad, it's all you can think about. Also, because your brain is fully aware that things are out of balance, so it's not going to let you think of other things. If the brain is occupied dealing with sickness, you can't be productive, you can't be fruitful in your endeavors. So just more updated research that chiropractic is an overall healthcare system. And stress, mood, anxiety disorders, I don't think that anyone's immune to that. And one great thing you could do, and I've seen it happen thousands of times, get adjusted, normalize your brain patterns, free up the digestive system, and get the gut-brain connection working together. Because they're important. You can't separate one when you're talking about a mood or mental health issue. And the more research that's coming out, more of it's being tied to your gut. And certainly we can take a lot of stuff to improve our gut, but if we can improve our brain's connection to our gut, then you're hitting it at the highest level. All right, guys, thanks for your time. Be well.